Welcome to RNA's Advanced Clinical Practice Fellowship Program Information Session. In today's presentation, we will be going over some of the application requirements and sharing key resources. During today's webinar, we will briefly review the ACPF program, the eligibility requirements and how to apply, review the proposal sections, and share key resources. So let's get started. What is the Advanced Clinical Practice Fellowship? ACPF is RNA's fellowship program, which is open to both members and non-members. It has three main benefits. First, it allows for a unique opportunity for RNs and MPs to meet a specific learning need through the support of their organizations and RNAO. It fosters a mentoring opportunity, as one of the criteria for this fellowship is that the applicant works with a mentor. And finally, it helps the nurses organization improve patient care by way of educational development of their nursing staff. The applicant's learning needs should drive the proposal.
The goals of the ACPF include the following: to develop and promote nursing knowledge and expertise, to enhance the capacity to lead change, to support the uptake of evidence-based practice, and to support the achievement of the Quadruple Aim and United Nations Sustainable Development Goals. Not only does the ACPF support the achievement of the Quadruple Aim, which entails improved patient experience, improved patient outcomes, improved provider experience, and lowering the cost of care, it also addresses the UN Sustainable Development Goals with a lens of tackling population health, supporting underserviced populations, and promoting health equity. We currently have 5 streams, with 4 streams being new. The Advanced Clinical Practice Fellowship Ontario Health Teams, or ACPF OHT, is a separate ACPF for Best Practice Spotlight Organization Ontario Health Teams, or BPS OHTs, and is currently in its second cycle. The 4 new streams include the following: Leading Change in Evidence-Based Practice, with 3 substreams being Individual Change Agent, Clinical, Change Team, Leadership, Organizational, Guideline Implementation, Equity in Nursing and Health, with potential substreams being Indigenous health, anti-Black racism, and 2S LGBTQI+, health and well-being, and long-term care. So in terms of the Leading Change in Evidence-Based Practice stream, fellowships in the stream will have a primary focus on one of 3 substreams. Fellowships in these substreams are encouraged to use resources, approaches, or tools from RNAO's 3rd edition Leading Change Toolkit to support the advancement of your goals. This may include the Social Movement Action Framework, Knowledge to Action Framework, or strategies in the section Engaging Persons with Lived Experience. Substreams include Individual Change Agent Clinical, which is focused on the development of knowledge, skills, and expertise in a specific area of evidence-based practice that will enhance care delivery in an organization or community. For example, it could include gaining a deeper understanding of an area of clinical practice, such as providing palliative care to children and their families, developing advanced pain assessment skills, or enhancing wound management knowledge. Change team leadership is focused on using strategies to mobilize and engage people to support the uptake and sustainability of evidence-based practice. This may include enhancing skills in areas such as education, research, management, or policy through the engagement of change teams within an organization, like implementation teams, persons with lived experience, like patients or families, or other stakeholder groups within or outside of your organization. Finally, there's organizational guideline implementation. This substream is focused on gaining the skills necessary to support the implementation and sustainability of a specific RNAO best practice guideline. Fellowships in the stream will explore one or more aspect of the implementation of practice change and will be expected to utilize frameworks, processes, strategies, and tools within the 3rd edition Leading Change Toolkit. Next, we have our Equity in Nursing and Health stream, which is focused on addressing diversity, equity, and inclusion in the workplace, and aligns with RNAO's commitment to address systemic racism, injustice, and discrimination, and improve health care for all. Fellowships in the stream are intended to strengthen knowledge of equity and may focus on celebrating or improving diversity, equity, and inclusion for staff, persons, and families receiving care, or communities. Examples of fellowship topics include addressing anti-Black racism in the workplace, creating safe spaces for 2S LGBTQI+ persons within the health system, or improving Indigenous health services by addressing a particular call to action from the Truth and Reconciliation Commission report. Within this stream, priority will be given to those individuals who self-identify with a community that is the focus of their fellowship. Those who do not self-identify with a community focus will be required to demonstrate in their proposal how they have prepared themselves for the fellowship experience. For example, those wishing to focus on it working with Indigenous communities would be expected to have participated in and submit evidence of cultural safety training in advance of starting their fellowship. Next, we have our health and well-being stream. Fellowships within the stream are focused on developing resources, approaches, and programs that will improve the health and well-being of nurses and colleagues in the organization and our community. This fellowship stream has been established in response to the current health human resources crisis and a reported increase in nurse fatigue and burnout associated with the COVID-19 pandemic and the chronic shortages of nurses within the system. Fellowships in the stream may focus on promoting well-being and creating a healthy work environment, improving recruitment or retention of nurses, or providing mentorship or support for new staff. And we have our long-term care stream. So fellowships within the stream focus on developing resources, approaches, and programs that will support student clinical placements in long-term care homes. This fellowship stream has been established in response to the need to develop positive, engaging clinical placements for third and fourth year nursing students. As a recruitment strategy, this will provide nursing students with the opportunity to experience the range of nursing leadership roles in long-term care and ultimately encourage long-term care as a sector in which to develop their career. Fellowships in the stream may focus on developing creative student placements that help develop clinical, leadership, advocacy, and quality improvement skills.
Now let's have a look at ACPF by the numbers. RNAO issues 3 request proposals every year. All of these dates can be found on the RNAO website. This fellowships are 450 hours in length and may be completed on a full-time or part-time basis. Each successful applicant will receive $15,000 in funding to complete their fellowship. The applicant's organization must also commit a minimum of $5,000. This may be in kind or in a monetary contribution. Now that we've gone over what the fellowship program entails, let's talk about the eligibility requirements. In order to be eligible to participate in a fellowship, you must be working as an RN or MP in Ontario, have at least 1 year of nursing experience, be employed on a full-time or part-time basis, and able to dedicate 450 hours to the ACPF learning experience, have available mentor in the area of focus, have employer support, which means having adequate funding and material support, a minimum of $5,000 contribution, which can be in kind or monetary. It also means having a culture of learning in which the fellow has support necessary to succeed. Now let's move on to the application process. The application process is now easier than ever. Step 1 entails reviewing the RFP. This document outlines all of the necessary requirements and components of the proposal application. It is very important to review this document before you apply. The RFP outlines exactly what should be included in each section of the application and is extremely helpful in submitting a successful application. I would encourage applicants to use the RFP as a checklist when reviewing their application before submission to ensure that you've included all the necessary information. Step 2 is intent to submit. This is a mandatory part of the application but is not binding and can be modified after submission. Step 3 is completing the online application. which includes information about the fellow, mentor, or an organization, the need for the project, a budget, and a learning plan. Now we'll move on to the proposal application. The proposal is broken down to 7 sections, each weighing a different percentage. As you can see, the learning plan has the highest percentage. This is really where the applicant will lay out their objectives for the fellowship and articulate what it is they would like to accomplish through the fellowship. It is really the blueprint of the fellowship. We suggest the applicant start their application by completing the learning plan. Once that's completed, the rest of the application becomes very easy to finish. The learning plan is a checklist. The learning plan checklist is available on the website for applicants to ensure that all the necessary requirements are met. Applicants will need to submit the following documents to accompany their application: the applicant's resume or CV, a letter of support from the applicant's direct manager, a letter of support from the applicant's senior manager, a letter of support from the primary mentor, and the resume or CV for the primary mentor. Now that we've covered what to include in the application, let's move on to the review process. Proposals are reviewed by an external review committee, which is comprised of nurses. Each proposal is reviewed by at least 2 different reviewers. In some cases where there is need for consensus, an inter-rater reliability testing is done, which may involve a group review. Once the review process is complete, applicants are notified whether their proposal has been accepted or declined. Regardless of the decision, detailed feedback is given for all applicants. Selections made by RNAO are based on score, funding availability, and revisions required. The RNAO has a number of resources to assist applicants with the proposal development process. There are a number of fact sheets and tip sheets available to assist the applicant through the application process. These include a tool to assist in choosing a stream, a learning plan checklist, a fact sheet for nurses. This is a quick overview of the program and its benefits for you and really what's in it for you. A fact sheet for the sponsor organization and mentors. This can be helpful for both the applicant and either the mentor and sponsor organization, as it outlines the benefits and expectations for both parties. These are great to use when approaching a mentor or organization for involvement. We also have a number of informational videos and webinars to assist you in the application process. These include developing your learning plan and the ACPF overview information session, which is what is covered today. You can find the following on the ACPF webpage of the RNA website: the request for proposal, which is a guide again to outlining what is to include in your proposal. This document also outlines the review process and highlights other key details regarding funding. We also have examples of successful proposals, which you can request if you send an email through the website. Another helpful resource are the executive summaries. These are helpful in a number of ways. Whether you aren't sure what stream to pick or how to roll up your fellowship plan, these executive summaries are an excellent resource for applicants in any stage of the application process.